We are ready to reconvene. Just wanted to say hi. How are you doing?
I've been meaning to circle around. You're doing a great job.
Thanks. I knew you were in the room.
All right. Good afternoon. Thanks so much for joining us for this final session of the day. And during this session, we'll hear a report on a study of medical insurance coverage for college athletes from Jon Oliver, chair of the LEAD1 Association Medical Insurance Coverage Task Force and former executive athletics director at the University of Virginia. As we said earlier, these conversations will be live streamed, and please use the microphones when speaking. Jon has some handouts that board members should have received earlier, and they'll be available to the media and attendees. So Jon, thank you so much for your hard work. Thanks for your time. I look forward to hearing what you have to say, and then we'll have some questions afterwards. Thank you.
I want to say thank you to the Knight Commission for having me here today. This is a topic that I believe is critically important. If you think about the sessions you've heard earlier today, a lot of this also comes back to the overall health and well-being of student athletes and how are we going to treat them at times when they get injured. So why are we here? In 2016, Tom McMillan of the LEAD1 Association scheduled a webinar for a number of schools to study a private sector proposal that would have collectively found a way for schools to pull together to purchase insurance to cover student athletes. We all went through that webinar, and a number of us had concerns after the webinar about the possibility of actually doing that. I was fortunate to be in a meeting with Tom a couple of weeks later, and I raised some of my questions about that, and he talked about the possibility of forming a task force to study this sort of proposal. So we put together a group of people, and it was mainly a group of people that had asked similar questions since the time of the webinar. We created a task force. We also added an insurance expert, David Brookbank, who specializes in loss of value and permanent disability insurance, but also has experience in this area, to begin to study, could this really happen? And where we started was looking at the NCAA survey they conducted in February of 2016 on this topic about what were athletic departments doing to make sure that student athletes were covered with medical insurance and how were they covering their medical expenses. We first reviewed that information, and although it was very informative, I don't think it really helped us understand in true detail what type of process athletics departments were going through on a daily basis to meet the needs of their student athletes, both from an injury prevention standpoint, medical insurance coverage, how they dealt with trainers, where did the physicians see them, how did it impact time demands, a number of different categories. So the first thing we decided to do is we felt we needed to do another survey that would go deeper into the process of understanding what was actually happening to then, again, tie it back to, could you then find a collective way to provide insurance policies to cover student athletes? We started by building a matrix, and I know I've handed out information in advance to a number of you, and you should have that information. But in that matrix, we went through the process of, okay, from the time a student athlete arrives at your institution, if your institution has a requirement that they must have insurance, athletically related injury coverage insurance, all the way down through injury happens, do you check for insurance coverage? What happens next? We walked all the way through that. And from that, we determined what questions we would need to ask as a follow-up to determine what people were actually doing. We sent that survey out to a number of institutions, and the results of which I'll talk about mainly here today from a Division I and primarily an Autonomy 5 perspective, because we believe that's where you can make the most in terms of a move to collectively deal with student athletes. What we found from the survey results were that people are generally doing a good job in this category. What is going to be a challenge moving forward is, over time, people have found creative and effective strategies to do what's allowed within their jurisdiction, their institution, or within their state. There's a lot of procurement restrictions. There are some states that have formed consortiums of a number of schools to provide this coverage. There's a state in this country that doesn't allow you to provide insurance policies for students or student athletes. So there's a number of different things that are in play that allow you to provide medical care for student athletes. a significant number of people are using the student-athlete policies as they bring from home. And that happens primarily when it has an athletically related injury coverage rider as part of it. When that doesn't happen, you're finding that institutions either self-insure, they pay for it themselves, or they go out and buy secondary policies. The NCAA also has a basic accident medical coverage policy. As you can see from the information I gave you, though, it's not being used on a broad basis, and as we dug into that, the reason being is it's not the cheapest policy out there. When you think about procurement requirements at each institution, most times it's based on cost. So they're not selecting that. That does not mean people aren't going out and buying policies. There are a number of institutions that require students in general to have policies, and in many cases, they come with athletically related injury coverage as part of that policy. So what you're finding is many athletics departments are accessing those policies and they're paying the deductibles, whatever it takes. At the end of the day, the student athlete's not paying out of pocket, the family's not paying out of pocket. So what should we be concerned about in that category? The Affordable Care Act. What's happening? What's happening on the national stage with health insurance coverage? I think we all know something's going to change. And what we did find is that a number of people don't do a great job of verifying coverage on a regular basis. There are plenty of situations where a student athlete might lose coverage for a particular window of time, and you wouldn't necessarily find that out until such time there's an injury. And then you're going to have to find ways to actually cover what you promised to cover. So I think that's going to be an important consideration moving forward. But again, I would tell you, most schools at the Autonomy 5 level are doing a great job. Now, are there things I think that they could do better? There's no question about that, but that wasn't my initial charge. Our charge was to figure out, could you find a collective way to do this? And I think it's going to be very difficult for some of the reasons I mentioned before. I just don't think you can get enough mass with a number of schools based on their restrictions to be able to find a one-stop shop for institutions to go and buy their policy coverage for all their student athletes. That does not say institutions won't continue to find creative and effective ways. When you look at schools that have health systems, many of them have found ways to access the physicians and medical care within that health system. They've negotiated effective rates. And in fact, if you think about the time demands of a student athlete, this sort of concierge service where many physicians that have to meet with student athletes are actually coming to the training rooms and seeing them. Imagine that student athlete who wakes up early in the morning, he's going to class, they're studying, they have to go to practice, they've got film, there's a number of things they're doing. If they then have to go to the training room, then have to go to a physician's office and find those hours to do that, that begins to impact their time demands. So many institutions have found ways to even create, in some cases, provider-based clinics where the physicians can see them in the training room, and then that's covered under insurance. So there's a number of different good things out there that are happening that are effective. Now, beyond the charge, here are some of the things we found that we created a list of 13 sort of advisory best practices that institutions could begin to look at. And unfortunately, I can't talk about those here today because they were presented back to LEAD1 and the NCAA through our partnership, and they're being vetted now. But I can generally talk about some of the categories that clearly I think you need to have dedicated professionals within an athletics department, more so than just trainers making decisions as you go. You have to have an effective structure to be able to find ways to make sure that things are in place to cover that student athlete. How do we communicate with our student athletes and their parents on a regular basis? Sure, we all say in the recruiting process that we're going to take care of your son or daughter. But what do you do on a regular basis to help that family understand that if your son or daughter gets injured, here's the process that we will go through to make sure that they're covered? Because any of you that have children, when they get injured, right, and then somebody tries to explain something to you, that's not a good time for you to try and understand how it all works. So I think there needs to be regular and effective communication with families about exactly how it happens. This whole notion of continuing to rely upon family policies, I think, will become challenging moving forward. And there's going to have to be an effective monitoring system as the Affordable Care Act and other insurance regulations continue to evolve. What will be done to make sure that the athletics department of the institution picks up that requirement if those things go away? Now, what are people potentially afraid of? What's the cost? You heard in the last session, you've heard in a number of sessions that this whole model of athletics isn't financially sustainable. So I think there's a number of concerns about, is there going to be added costs moving forward? That should not be confused with people don't want to take care of their student athletes. People want to find the most efficient and cost-effective way moving forward to do that. So in my humble opinion, I think that a lot could be done through proposed NCAA legislation that might handle minimum standards of care with student athletes so that everybody knows what's expected. But I think that's going to require a great deal of education and collaboration amongst institutions. I think that if institutions really understood what others were doing, their peers were doing, they would find that the minimum standards that I think should be moved forward aren't hard to meet, and there should be some flexibility that would allow you to meet those minimum standards. I know there are some people looking at those things, but I think as a best practice moving forward, I think it would be advisable to get to some level of minimum standards for care for student athletes. And I'm talking about scholarship and non-scholarship athletes, although my comments here are generally about Autonomy 5 institutions. The other thing that I think would be really important is to continue to find ways to make sure that mental health doesn't take a back seat to this issue. We all think about the physical injuries, but you're just starting to see a number of institutions create a great deal of focus in this area. And whether it be within your athletics department or if you send people out to institutional resources or within the local community, there has to be a commitment to this along the way. And the reason I say that here is any medical insurance policy that you create or procure should have an allowance for that within the policy, because those are important issues. There are athletics departments now, Virginia being one of them, and a number of schools also have this. We have 2 full-time professionals now. We have graduate assistants that work in this category. It's important for people to understand that this has to be part of our overall medical coverage that we provide for our student athletes. The other thing that I think is going to be important moving forward is this whole category of injury prevention. At most institutions, you have an academic department that can help create strategies to monitor what's happening in practices and competition and to find ways to effectively work to prevent injuries, and they should be involved in that process as part of the overall suite of what you offer to take care of your student athletes. You heard it in the last session. There are a number of people doing great things, but as we continue to work through this category, it shouldn't be just about what do we do after the student athlete is injured, but what do you also do to help prevent injuries along the way? So I think that one would also be important. At the end of the day, although institutions are committed, in my opinion, in this category, the sharing of information, I think, is going to be critically important even before any type of legislation is proposed. Because I think there's a feeling out there, we do a good job, don't tell us what to do. But similar to what you heard in the last session, if institutions don't find a way to address the problem, somebody else will do that for them. And again, as I said earlier, a sort of minimum standard of care that could be codified through NCAA legislation, I think would be critically important moving forward. And I think if you do that and engage in those conversations early, it might be easier to get Power 5 or Autonomy 5 institutions to buy into this concept. But I think that will be necessary. I think there might be some level of hesitance because I don't think people truly understand that I don't think it's going to cost them much more to do exactly what we're talking about here today. So again, I've given you a great deal of information. I'd like to open it up for questions to address any concerns you might have.
So one piece, I think you spoke a lot about kind of when you have the student athlete and kind of how colleges and universities are taking care of them. One piece that I'm intrigued by is this loss of value piece, because I think that for every person that's talking about why do we have one and dones, why do you have people leaving college after 3 years without graduating, because I think there's a real fear of, there's a moment in time that I think David spoke about before about when you can actually capitalize, and we all have a time horizon in which our bodies are probably not going to hold up in the same way. So how would you think through that piece for colleges and universities, or what kind of conversations are happening in and around that? And I understand it's a small percentage of people that we're talking about, but I'm just curious what's being done there, and or if you have any insight on that.
I'll figure out soon that you got to turn every time you talk. But I don't want to just talk about loss of value. I want to talk about permanent disability, because that potentially could impact more people than just our revenue sports in terms of loss of value. I think that moving forward at some point in time, and I think it's very soon, there's going to have to be something that's put in place that protects all student athletes from a permanent disability standpoint, and then for your revenue sports in particular, loss of value. David Brookbank, the person I mentioned earlier, he's an expert in this area, and he's done a number of things to help institutions understand how that works exactly. And I would ask the Knight Commission, I would think you would want to invite David here, because if you understood what's happening in the landscape with loss of value and permanent disability, imagine being a student athlete and your parents have been telling you forever you're going to go pro, and you think you're going to pro. You're really flattered, but all of a sudden somebody telling you need a policy. Well, how do you know it's the policy that works for you? And whether your family's paying for it or the institution's paying for it, how do you know that's the best possible policy for you? And I think there needs to be more expertise applied to that category to help them do that. But I think there's some people prepared to talk about and deal with that, and I think it's going to be critically important. But more related to what we're talking about here today, that permanent disability, I think, is an important factor. I'm of the opinion that if you create, again, some minimum standards, the marketplace will begin to create products that will make it more cost-effective and efficient for institutions to offer these type of coverages. And I think there's a way to do it. The other thing we didn't talk about briefly, and this is an advisory practice, it's not something we really talked about, similar to what the Pac-12 has done, forward thinking, 4 years after an injury to be able to cover. In my opinion, it's just my opinion, I think it should be a minimum of 2, but it should follow a well-documented process of what the injury is or injuries were to make sure that when they're coming back, it closely aligns with the concern that everybody was already aware of. But let's take another category, concussions. The effect of concussions don't necessarily happen in a 2 or 4 year period. But is there a way to create a product in the marketplace, permanent disability, that no matter when it happens, during the time the student athlete was there, enough premium was paid so that it covers them for the next 20 or 30 years so they could come back and get coverage. There are opportunities out there for that type of thing, but those things will only follow discussion, dialogue, and a commitment to doing those things in an effective way. I think once you get into that, I think the marketplace will bring things forward that will allow people to begin to address how it can happen.
Yeah, this has been a very interesting session. I wanted to ask you the question of, you're focusing on the autonomous 5 conferences for political reasons, for financial reasons? Why just them? I was president of a non-Power 5 university, and I'm just as worried about the health and welfare of my student athletes.
We partnered with the NCAA to take a deeper dive in Division II and Division III. And what you find there in those categories is that mainly they require that the student athletes bring insurance to the table. They're not paying for those policies. So what we're looking for is a platform to be able to introduce at a level where the resources exist to create a standard of care for student athletes, and then from that, hopefully it will follow down in terms of what people should be doing, generally no matter what the source of insurance coverage is. And again, I'm mainly focused on Autonomy 5 here with my comments, but we gathered a lot of information. We shared that back with the NCAA. They were a great partner because they allowed us to do the site visit. We visited 31 institutions to take a deeper dive to figure out what they were doing. A number of those were Division II and Division III institutions. They have the same challenges that Division I and Autonomy 5 have, but not in the same way. But I think there will be opportunities eventually for them to be engaged in this conversation as well. And I think the NCAA can take that lead. That's why they partnered with us.
Any further questions?
I have one, Arnie. John, you mentioned mental health, and it's an area that we're beginning to hear a lot more conversation about. Could you elaborate a little bit on your comments?
So it's kind of strange to me that this is just now becoming important. When I first arrived at Washington State in 1995, there was a full-time psychologist on staff then. And what we found was when you have a psychologist on staff engaged with student athletes when it doesn't matter, they're more inclined to reach out to that mental health professional when it does matter. If you have a system that is, whether it be university resources or a local practitioner, and all of a sudden something's going on and you send them out, it's going to be pretty difficult to get that person to engage in a way that allows them to truly deal with their issues. So a number of institutions, and I think this will continue to grow, are beginning to have mental health professionals on staff that allow the student athlete to see them on a regular basis. There's not a stigma attached to it. They're engaged in team activities. They're around the athletics department. They're going to practices. They're going to games so that when you know there's a concern, you're reaching out to the professional. I think that's going to be important moving forward. Again, additional positions, but I think it's critical. Now, in that category, you've got to reconcile what your approach is going to be. If you ask a coach, do they want that? They say yes, but what they want is sport performance, right? Most times what you should be focused on first is a clinical approach to making sure the student athlete is able to handle all of their responsibilities. And at Virginia, that's the approach that we took. And we found our approach kind of was, if there's an issue, the psychologist's job is to help get them their mind clean again so the coach, as the expert, can work with the student athlete using their expertise. So that was kind of our approach. But I think that's going to be an important category moving forward. And under what we're talking about here today, if there are issues in terms of who's paying for it, how it happens, if you have to get additional resources, there should be medical insurance coverage in place to help deal with that.
Hi, John. Just a quick question for you about the nature of the injuries. I mean, obviously you can't identify particular cases, but can you discuss sort of trend lines? What kinds of injuries are we sort of seeing more of, less of? Is this about concussions, knee injuries, broken limbs, non-athletic injuries probably in some cases here, but is there any learning as you've done this analysis that you can take away about just the kinds of medical conditions or injuries that we're seeing and whether there's any trends that you can sort of speak to on that score? Thanks.
So Val, we didn't ask specifically, give us the type of injuries you've had for the last 3 years. But what we did do is we asked about what are your concerns? What type of injuries are you seeing? And what we found, and this will not be a surprise to you, it was mentioned in the last session, I believe. Think about youth sports now. Young kids are so focused at an early age, and they're playing one sport, and they're not getting rest throughout the year. By the time you're getting a student athlete at an institution, there's a history of injuries, and people are going to have to make a decision. Will you deal with pre-existing conditions? Now, I think that's easy to answer. If you've recruited somebody, you've signed them, they've committed to you, you want them to be able to contribute, so most likely you're going to handle whatever it takes to get them in place. But it's like dating. During the recruiting process, that student athlete's not going to tell you all the injuries they've been through. They're going to try and, everything's fine, we're going to be okay. But when you get them, when you start doing those physicals, you begin to find issues, and many times you're seeing student athletes now, you're doing surgeries right away before they even step on the practice field or court. So I think that's a trend that we're going to have to pay attention to. And then it's the sharing of communication amongst everybody that deals with that student athlete, and I think that begins to help with concussion type issues, that it's not just the trainer. It's the academic coordinator. It's the strength coach. A number of people see these student athletes on a regular basis, and if they collaborate, you can begin to see sort of some of the things that are going on. When you have a student athlete that's tired, fatigued, whether it be from studying too long, being up, late, class, that whole time demands component, you're more prone to injury if you're not careful. So there has to be things that you have in place that allow you to monitor that type of thing. So again, under the category of injury prevention, I applaud the time demands legislation that was put into place, and I hope in practice that it really turns out to be what it was intended to be, because I think that will help in this category as well.
No further questions, John. Thank you so much for your hard work. Please give him a round of applause.
Thank you.
I think we can adjourn and meet back for the executive session 1:45. We'll have lunch in the interim. Go ahead. Yeah.
Well, we could,
That's fine. So see if. Yeah, that's fine. Tell them to do it 12:45.
okay. So given that we finished a few minutes early for the media, we'll start the press conference at 12:45.